Sumaya, 21-year-old girl, developed sore throat, cough, and sputum. These symptoms continued for a week, but then resolved spontaneously. She did not take any medications or use any antibiotics. This happens despite that the cause of her problem was Streptococcus bacteria. Sumaya was having bacterial pharyngitis. We usually treat bacterial infection by antibiotics, but even if no antibiotic is given, most people get rid of infection by the activity of their immune system. In this case, acute inflammation was the mechanism of the immune system to achieve that. We might have heard that inflammation is bad, but actually it is not. Inflammation in its basic role is protective and help us to fight infection. When our tissues are invaded by microorganisms, local tissue damage and some activated local immune cells release chemical messages known as mediators. These messages or mediators then work on the blood vessels on the area of infection and results in a call for help to fight that infection. The term inflammation is actually, in short, is that call. This first thing that happened in Sumaya throat was bacteria present in the environment or acquired by contact with a sick patient, which get its way to her throat. As it was in her pharyngeal tissues, two things happened. First, the bacteria start damaging cells, and second, some cells scattered in her tissue recognize that there is foreign body. These cells are known as antigen-presenting cells. As a result of inflammatory mediators, two major things happen. First, changes in arterioles and venules known as vascular changes. Second, special type of leukocytes, white blood cells, known as polymorphonuclear neutrophils, are delivered to the site of the Streptococcus bacteria. The two steps occurred in sequence because neutrophils will only pass if the vessels increase their permeability, allowing them to reach tissues. At the beginning, there was a moment of vasoconstriction, but that was followed by prolonged vasodilation. Venules and arterioles at the site dilate from relaxation of their surrounding smooth muscle wall. Because of this dilation, more blood becomes available at the site, and blood speed in the site becomes less. The slowness of blood then helped white blood cells running in the blood to start adhering to get in touch to the vascular wall. The endothelial cells line blood vessels. They participate in the process by increasing the space between them. This allows proteins to pass to tissues. These proteins include complement proteins that participate in fighting and antibiotics of the immune system. Also, endothelial cells participate in the process by expressing adhesion molecules. Think that we are in a road and special gas stations start to raise flags to green-colored car to stop and get gas for free. Now we are going to have all green cars stop and fill their tanks. Similarly, endothelial cells express adhesion molecules flags known as CD31 and others, which are recognized by polymorphonuclear cells which attach and stop. The process is more advanced and sophisticated than this because the leukocytes themselves also express adhesion molecules complementary to those on the surface of endothelial cells. If they match, adhesion happens. And if adhesion does not happen, leukocytes will not pass to site of infection. Neutrophils first start rolling, then firmly adhere, then transmigrate and migrate to tissue of infection when they are engulf bacteria and kill them by the process of phagocytosis. As we understand that, we know that there are steps occurring in sequence, and if adhesion does not happen, the next step will not happen. There are diseases associated with deficiency of some adhesion molecules, and patients with these disorders become more susceptible to infection. For example, there is autosomal recessive disease known as leukocyte adhesion deficiency type 1. Patient has defect in special adhesion molecules known as CD18 or LFA1, leukocyte function associated antigen 1, which is important for neutrophil adhesion. Patients with this disease get recurrent skin and mucosal bacterial infection, absent of pus, and impaired wound healing. Back to Sumaya, her adhesion molecules are good. She developed acute inflammation that results in leukocyte recruitment to the site of infection and resolvement of the disease. This has taken few days to complete. Thus, we see that inflammation is helpful and protective. Nevertheless, we shall explore that sometimes inflammation can be problematic, for instance, if it is prolonged, autoimmune, or exaggerated.